Hi everyone, my name is Anthony, and I would like to introduce you my results from one systematic review we conducted in 2021 on efficacy of physiotherapy interventions for the management of adults with cervicogenic headache. I'm currently associated researcher in Paris in the ECAMO team from the INSERM, and I'm specialized physiotherapist working in Paris on chronic pain and headache patients. What compelled us to do this research? The cervicogenic headache is the most prevalent secondary headache among all headache patients, so it's a public health issue. And often there is a wrong diagnosis between cervicogenic headache and migraine. So we need to optimize the management we could provide to patients with cervicogenic headache. So we conducted a systematic review with meta-analysis to update and appraise evidence on the efficacy of physiotherapy interventions, such as manual therapy or exercises, for the management of adults with cervicogenic headache. The last systematic review published on the same topic was in 2016, and we update the data until September 2021 on the 5 main databases, as you can find on the slide. The biggest takeaway messages from our results could be based on the 14 RCTs we included in this systematic review, based on 1,112 patients. We could conclude that there are evidence of moderate certainty that manual therapy leads to a significant short-term reduction on headache frequency compared with sham manual therapy, and headache frequency and intensity compared with no treatment, so only 2 weeks post-interventions of manual therapy. The main and the key message is that moderate certainty that manual therapy does not reduce headache in the long term, so 12 months after the intervention, on headache frequency and intensity compared with sham manual therapy. Only based on one RCT of high methodological quality, specific cervical exercises based on strengthening exercise appear to reduce headache intensity over the long term, so 12 months after the intervention, compared with no treatment or aerobic exercise. So how we can use this information tomorrow in your clinical practice or as a researcher? There is a probable benefit of combining manual therapy and cervical exercises, especially if you can identify and assess the patient expectations to determine whether manual therapy is appropriate or not. If the patient has specific expectation to receive manual therapy, you could provide both manual therapy and exercise as first aid. As a perspective for researchers, there is a big need to conduct a randomized controlled trial comparing PT interventions to usual care, such as medication or education, provided usually by physicians in primary care setting, with long-term data collection, so over than 15 months. You could find this research on PubMed, because this systematic review was published on PMNR, so the Physical Medicine and Rehabilitation Journal. So thank you to listening and have a nice day.